Well, welcome to the podcast, Morgan Fulton.
Yeah.
Happy to have you. I do have an intro prepared that I'm going to read.
Okay.
Welcome back, everybody, to the Headwater Sage podcast. Today is a special one as we're joined by someone whose work deeply resonates with our mission here at the Blake Matthew Mindful Memorial Foundation. She runs a business that supports whole person healing and reconnecting with our truest nature. Our guest, Morgan Fulton, is the founder of Rewild Natural Health Clinic, a space built around the belief that healing is not something we force, but something we allow when we return to who we really are. Morgan blends functional medicine, herbal support, and nature-based healing with a grounded, evidence-informed approach. She helps people come home to their bodies, their rhythms, and their natural capacity to thrive. As we are incredibly excited and grateful to welcome her not only to the podcast, but also as an official wellness partner of the Blake Matthew Mindful Memorial Foundation, adding another powerful heart to this community of healers and supporters. Today, we're going to explore what it means to rewild our health and how stress in modern life can disconnect us from our true selves, and why nature is one of the most powerful medicines that we have. Morgan, thank you for being here. I'm honored to have you.
Thank you.
So let's start by, I guess, backing up in time a little bit. My first question for you is, what inspired you to create Rewild Natural Health Clinic?
I think just with my own health, I quickly came to realize that conventional medicine is more of a Band-Aid approach. And I wanted to be able to provide myself with true healing, being able to feel empowered, like I could change outcomes in my health by making changes in my daily life.
Okay. And when did that start, or when did you have that realization?
Probably in 2020, the COVID-19 pandemic. I also, right before that, I was unable to conceive a child naturally.
Okay.
So I went through IVF, the conventional treatment, was diagnosed with unexplained infertility. So they really didn't have any reason why I couldn't conceive a child. Went through the standard approach that everybody does of IVF, and still was unsuccessful in conceiving. And then I went on to adopt children and realized, how I could help them heal themselves, and quickly started to learn I could heal myself. Made a lot of changes to my lifestyle, and then I was able to conceive a child naturally.
That is so awesome.
Yeah. Yeah.
One child you've conceived naturally.
Yeah.
Okay.
Yeah. Yep.
So how many kids total?
4.
All right.
6 and under.
Okay.
Yeah.
Very cool.
Yeah.
Where are you from?
Laval.
Oh, okay.
Yeah. Yeah. I went to school in Waniwak.
All right. That's right. And then where did you go? You went to college to become a nurse practitioner. Is that right?
Yeah. So I initially went to nursing school. I became a registered nurse in 2016. And I worked primarily in medical oncology. That's my background mostly. I worked as an infusion nurse. I administered chemotherapy. But right after I finished nursing school, I actually started to take courses mostly online to become a nurse practitioner. And so I became a certified nurse practitioner in 2019.
Okay. And let's tell the listeners, how does a nurse practitioner, like with that title, how does that differ from a registered nurse?
So I can diagnose and treat patients, whereas a registered nurse, it's mostly just following guidance behind the doctor, a physician, administering medications, but it has to be ordered by a physician. So I can diagnose and treat patients.
Okay.
And starting next year, I'll be able to practice in the state of Wisconsin, practice independently as a nurse practitioner without any physician oversight.
Okay. So the part of the process of becoming independent is to work under somebody for a while.
No, the state of Wisconsin actually has passed a law that nurse practitioners can practice independently without a physician.
Okay. So
you do have to work under a physician for a period of time to be able to do that, though. Yes.
Okay. So I guess physician quote unquote being a medical doctor.
Yes.
But you have the ability to write prescriptions.
Correct.
So you're kind of a quasi-physician.
Kind of. Yeah.
Yeah.
Kind of. Yeah. A little difference, but.
So when you received your nurse practitioner, you had a job there as a nurse practitioner at where were you working at that time?
So when I first became licensed, I worked as a nurse practitioner in family practice. I worked there for almost a year. And then I got a position back in medical oncology where I was working as a registered nurse. And so I've been practicing there since 2020. Until just recently.
Okay. Well, congratulations on that transition.
Thank you. I also did practice I've been practicing functional medicine for about 2 years.
When did you open Rewild Natural Health Clinic?
Just in September or August, I guess.
Okay. So just a few months.
Just a few months. Yeah.
And you're booked.
Yes. It's very busy, very quickly. I feel very blessed.
What do you attribute to like the wild rush of being so busy when you first open your doors? Because that's so rare. Most businesses need several years before they get like to full capacity, and it seems you're already at it.
Getting there. I truthfully think most of the clients that I see just say to me, like, we've been waiting for something like this. I really think the pandemic has opened people's eyes to traditional medicine and its Band-Aid approach. And I think people are tired of it. And I think they want to really be empowered and change their lives and their health.
So rewilding, it's I wouldn't say it's a buzzword or even trendy, but it's I feel like it's a resonant word with a lot of people, especially since COVID, people wanting to, what does that word mean to you?
Well, rewild they use it in ecosystems. It's a term that's utilized to when man goes in and actually disrupts an ecosystem. Rewilding means that they will go into an ecosystem and try to restore it back to its natural state. And so man has disrupted, I think, our bodies, our well-being, and our health. And so my purpose or my goal is to restore ourselves as naturally as I can in the modern world.
Okay, awesome.
Yeah.
I like that. That's a great analogy. I was a conservation easement appraiser for 22 years, so I know all about land restoration projects. And so, yeah, for the human body, it's just a different ecosystem.
Yeah, right, exactly.
What need in this community and just communities in general do you feel traditional healthcare hasn't fulfilled that you are stepping up to meet?
Management of chronic disease, prevention of chronic disease, and treatment of chronic disease.
Okay. And how does your approach different from the mainstream healthcare?
Yeah, the type of medicine that I practice is treating the root cause of the problem. So it's trying to unmask, why people are experiencing either symptoms or diseases, and trying to help them heal their bodies without pharmaceuticals or, in combination sometimes with pharmaceuticals, depending on how sick somebody is. Does that answer the question?
Yeah, that's a great answer.
Okay. Probably the most common things that I see as I've started practicing are cortisol issues and insulin resistance. Those are probably the two big hormone disruptors or problems that I see regularly.
What does this look like? Like, walk us through like a first appointment with you.
Yeah. So usually a first visit with me is 1 hour. And we spend time mostly diving back into people's medical history, social history, stress, everything. And then we'll kind of go over symptoms that they're experiencing. And then usually I take quite a bit of time to explain functional medicine, its approach, what our goals are to do. And then I will explain kind of the body processes and what could be contributing to some of their symptoms. Then usually I'll make recommendations on labs or any other functional testing that's needed.
Okay.
And then we'll usually schedule a time for people to come back, complete those tests, and then we can meet again for another hour to kind of go over like just a treatment plan or kind of an overview of what we would do going forward to help kind of alleviate symptoms.
Okay. That sounds like a lot to cram into 1 hour. Do you have like they fill out something beforehand so you kind of have an idea of
Yeah.
before?
So right now my process is online booking, and I have patients fill out a lot of different intake forms that I review before the visit. But I usually will ask questions just after I review the intake forms too, just to kind of update my note and be able to update myself.
Okay.
Yeah, it is a lot in one 1 hour visit. A lot.
I'm sure. Let alone like to give you the time to explain like or even talk about the options of a functional approach.
Right.
Do you have access to like other medical records of your patients or?
So oftentimes if I feel like it's helpful, I'll ask for patients to fill out paperwork to release medical information to me, so I can get it faxed to me, like any medical information that they have from previous office visits, hospitalizations, whatever, labs, whatever I think would be helpful to have.
So when you make that request, do you have to specify exactly what you want, or otherwise they'll fax back a whole book?
Yeah, right.
Okay.
Depending on someone's medical history, it can be a lot of information. Mm-hmm.
So I know you've only been open since September, September.
Yeah.
But so it hasn't been like a whole lot of samples. But how would you guess how many people have you served?
Oh my goodness. Oh, I don't even know. Over 100.
Okay.
Yeah.
So in a typical day or week, how many people would you say that you?
I try to see 6 people a day.
Okay.
Yeah, that's kind of where I try to cap it out. Sometimes it's 7, but that's a long day.
Yeah.
Yeah.
And you're also a very busy mom.
Yes.
Wife.
Yes, and wife. Yes.
So you're not working 5 days a week right now, are you?
No. Yeah, I am.
You
yes.
are. Okay.
Yeah.
But
yeah.
like pretty good hours, like 8 to 5, something like that.
Yeah.
Okay.
I restrict it. Yes.
All right.
Yeah. Yeah.
What role would you say that nature and our environment play in healing the body and mind? Did you get into nature much, or are you more strictly like the physical body?
No, the whole body.
The whole body.
So my approach, when I see somebody, for example, when I have a new patient consult, usually the primary things I'll ask about are sleep, physical activity, mental, emotional stress, or just mental, emotional health, physical health, like physical history, surgical history. I'll go over sleep, how people sleep, symptoms that they experience, down to how often you have a bowel movement. I mean, everything.
So you've seen 100 people recently. What would you say is like the most common mistake that most of us are making, or the most common oversight, or maybe a better question is, what are most of your patients learning that they didn't know before?
I think a lot of people are learning the stress, or the effect of stress on our health, on our physical, mental, emotional health. And that can be, something like an extremely stressful situation, or even just day-to-day stress that we don't even recognize as stress.
Right. Yeah. The chronic stress.
Right. The chronic stress that we carry. And, when people have above and beyond that, that's when they'll, have symptoms usually where they're like, oh, I'm stressed, and they know it. But if people have that day-to-day chronic stress, most people don't have any idea how that affects them physically. And I've seen in labs how it can affect people physically, autoimmune disorders such as Hashimoto's, rheumatoid arthritis. I've seen those be diagnosed after someone has an acute stressful event on top of chronic stress.
Sure. So if you have this whatever, acute stress, chronic stress, you go to a doctor and you've had this stress for over time, so you've developed this rheumatoid arthritis, let's say, for example.
Yeah.
What will the traditional doctor do?
So the traditional doctor, if you say you were diagnosed with rheumatoid arthritis, you would be put on an immune modulating medication, something that essentially suppresses your immune system, tries to lower some of the chronic inflammation, because that's a result of chronic stress often is chronic inflammation, and kind of lower that inflammation that's occurring.
So it's a pill to help lower the
Pill
inflammation.
injection, yes.
Okay. And then what's the rewilding natural approach?
So it's teaching people how to lower inflammation in our bodies naturally through food, the things we eat, how we live our day-to-day life, how we manage our stress. So say I'm seeing somebody and I think a lot of their symptoms are attributed to chronic stress. I make recommendations anywhere from, making sure your blood sugar is regulated, your blood sugar is balanced throughout the day. Those are things that make us feel safe. When our blood sugar drops, for example, our cortisol tends to increase, and our cortisol is our stress hormone, and that can cause people to kind of go into fight or flight mode. And so I'll kind of counsel people on, how to eat to make sure your blood sugar is regulated and your body feels safe. How things like deep breathing, mindfulness, being outside in nature, walking can lower your stress, connect you to nature, make you feel more in your body, less disconnected. Herbs, recommendations for herbs. There's herbs that can help improve stress resilience, like Schisandra, Shatavari. Those are all herbs that can help improve someone's stress resilience. So lots of different things, and trying to do a whole person approach. Chronic stress is probably one of the hardest things that I see.
Yeah.
To treat.
Hardest things to treat, right?
Correct.
Because a lot of it involves a change of a routine in a person. And since we're such habit creatures, to change even one part of our daily routine is sometimes a big challenge or a big ask.
Yeah.
Do you start with small steps and work your way up?
Yeah. Yes, because it can be very overwhelming. And usually people who are stressed chronically can be very easily overwhelmed. That's usually a symptom of high cortisol, is people feel like their brains are just running on hyperdrive or overdrive all the time. And so taking in new information and making changes can be very overwhelming.
Yeah. But the conventional approach, or I guess the conventional, and not to anybody's fault, it's like, it's not even ignorance. A lot of it's just innocence. Like, people don't realize there might be somewhere else to go besides the hospital, besides the doctor, besides the local
Correct.
conventional clinic. So do you find that when people give you a call or step into your office, it's because they know they don't want, number one, they're not expecting a magic pill. They know that that a magic pill to mask a symptom is not addressing the root cause. Correct. So do you find that when people reach out to you or walk into your clinic, they are ready to do some work more so than people who are going the conventional route?
Yes. Yeah, okay. Usually. And most people, I think, that I see have been dismissed by their primary care provider or a specialist. The majority of the people that I see feel dismissed.
Yeah.
Or they don't feel like they're getting answers. They feel like their symptoms are being ignored, like they're, that they're not telling the truth, or that, your labs are okay, so you're fine. Okay.
And are the labs run at like a conventional clinic? Is that what you refer to it as, or what do you?
It's there's lots of terms I feel like you could use, but like, are you when you go to like your regular doctor, the labs that are completed?
Yeah, is that the same as the labs you're running?
No.
What labs do you run? And is this standard for everybody?
No. So that's why I usually will see people for a new patient consult first, because sometimes I'll see people and a lot of the labs that I would run are already, they've had done. Okay. So sometimes I'll just try to get that information from either the patient or from their physician. So it just depends. It depends the person. I do have like a full lab panel that it's very extensive. And most of those labs are not covered by commercial insurances or Medicare or Medicaid.
But some of them are?
Yes. Yeah. Okay. So it would depend on, usually coverage is dependent on someone's diagnosis. So for example, if I'm seeing somebody for a symptom and they don't have any conventional medicine diagnosis, a lot of times those things aren't going to be covered by their insurance.
Okay. And a physician, quote unquote, has to give diagnosis,
Correct.
quote unquote? Okay.
Yeah.
Okay.
Correct. So the labs that I offer, I have a cash pay lab, and so it's much less expensive to do cash pay for a lot of people too, than to utilize their insurance, because I can do cash pay or bill insurance. Whereas if you go to the hospital, those labs are always billed under insurance, so you're paying the price that the lab would bill your insurance.
Okay. And is it for you call them clients or patients?
Yep.
Or?
Interchangeably. I try to stick to clients.
Okay.
Yeah.
So do clients, or is it like a la carte menu where they can choose which labs how deep they want to dive? It's
Yeah.
up to
So
them.
usually when I see people for a consult, I will kind of go through what I think could be attributing to some of their symptoms, and I'll make recommendations on labs. Obviously, a lot of these things aren't covered by insurance, so I'll include pricing for everything. And some people want to do it all right away, and some people want to say, well, where should I start? And so it just depends. So some people want to start in one place, and some people are like, I just want to get all of it done and just kind of see where we're going. That can be a lot of information when they come back then, and so it's really nice to just have this is where we're going to start. So let's start with these things. And then as we get some of these things kind of figured out, then we can move on and do some more testing.
Yeah.
But I do anywhere from blood work to stool testing to saliva testing, urine testing, dried urine testing, lots of different things.
Okay.
Mm-hmm.
Hair
testing. Yes.
Yeah? Okay.
Yes. Yep. Yep.
Very cool. What do you think of when you think of, or how do you think about prevention versus treatment?
Oh, I don't know how to answer that question.
Are people coming to you who usually need a treatment of some kind, or do some people come to you and they're
all over
like,
the board?
Yeah, they're like, I know I don't feel like I'm really sick, but I just want to
live optimally.
Yeah, see what my levels are at. What can I improve on?
Yeah,
optimize.
Yeah, so that's probably 25 to 30% of what I see is people who are healthy and don't really have any complaints, and they just want to live optimally, just want to know what their labs are. I would say the majority of people that I see usually have a symptom, though. That's a good majority of people, but some people just want to make sure their labs are optimal and see if there's anything that they could be doing better in their daily life that could prevent any disease or anything down the road, especially people who have a significant family history of something.
Yeah. Okay.
Yeah.
Let's run through a list of the most common symptoms that you're seeing.
Oh, okay. Chronic fatigue.
I just have no energy.
Yeah. Weight gain.
Yeah.
Inability to lose weight.
Okay.
Constipation is a very common one. Diarrhea, bloating, joint pain. Did I say joint pain already? I might have. What else? And honestly, I have a lot of people who want to manage their disease, their chronic diseases naturally. They don't want to be put on medication, or they want to come off of their medication.
What about diabetes?
Oh gosh, I would say probably everybody I see has dysglycemia, meaning that their blood sugars aren't balanced.
Almost everybody?
Almost everybody.
Even the healthy people?
Yeah, correct. Yeah, correct. But I would say over half of the people I see are insulin resistant.
Now I'm scared to get tested.
Uncovering.
When's the last time you tested yourself?
Let's see. No, probably not long after I opened, I had labs done.
Okay.
Yeah.
Cool. You feel pretty good? Did you find something you wanted to work on?
Yeah. Oh, yes, of course. Yeah, of course. I mean, I own a business and run a business, so yeah.
So you mentioned that cortisol is the stress hormone.
Yes.
Is that right?
Yeah.
How is what? So this is basically a marker of your stress, right? Someone with high cortisol is probably someone who's more stressed out. Is that always the case?
No. So cortisol has a pattern to it. So how cortisol's pattern should be is it's the highest when we wake up in the morning. That's what makes us feel awake and alert and ready to start our day. It kind of plateaus in the morning, and then it slowly tapers off throughout the day. And then at night, it's at the lowest it should be so that we feel tired and are able to fall asleep. Once cortisol drops, that's when melatonin increases. And then we should have a restful night of sleep. And then that process should start back over again where melatonin drops, cortisol increases.
Okay.
A lot of times what I'll see when I do cortisol testing, which is saliva testing, and that's testing like a cortisol curve. I see people with flatline cortisol, meaning that their cortisol is just low all of the time. Or I'll see people who have kind of a inverted curve where their cortisol might be high and then it drops really low and then it increases before they go to bed. And so for people who have difficulty falling asleep or staying asleep, cortisol tends to be a big key player in that process of sleep.
So that in that last example, that would be like maybe somebody who wakes up and feels good until noon and then they have a crash and they're really tired and maybe they're tired around like supper time, but then they go to sleep and they're like, oh, I got a second wind.
So a common symptom that people have when they have cortisol issues is wired but tired.
Oh.
So they'll feel tired all day, and then when they go to bed at night, they're wired and they can't fall asleep.
Oh, God, I've had that.
Yeah, crashes in the day, though. So the two biggest disruptors of sleep are cortisol and insulin. Insulin is also something else that can cause that crash. So your blood sugar decreasing or dropping, say after lunchtime, sometimes that can cause a crash in people where they'll feel tired. Crashes after meals tend to be more of an insulin problem than a cortisol problem.
Okay. So for clients that have came to you and said, I just want to learn how to manage my diabetes naturally, you got any success stories you can talk about?
Yeah, I mean,
without names, obviously.
Yeah, but I mean, type 2 diabetes is reversible. It's reversible. You don't, just because you're diabetic doesn't mean that you have to eventually be on insulin and then eventually you're going to lose your toes and, have a heart disease. That's not true. That's the most empowering thing about functional medicine is that you can change everything, balance your blood sugars through food, managing your stress, exercising. And I don't mean running, half marathons or anything, just walking outside.
Yeah, body movement.
Yeah. Those types of things can actually prevent things like diabetes or even reverse it.
Awesome. Oh, shoot, I got to put my phone on Don't Disturb. Someone's going to call me.
Yeah. And I've had people be able to come off of insulin or,
that's awesome.
Not have to start insulin. So, yeah.
So this functional medicine that you practice, I'm sure every functional medicine clinic maybe has their own twist or spin or way of practicing. How much functional medicine have you seen be integrated into what we would think of as conventional clinics?
Chiropractic care. I mean, I feel like chiropractic care was kind of like considered woo-woo a long time ago, but I feel like that's been integrated a little bit more for if people have musculoskeletal complaints. There's another, something else that they actually do for people who have like urologic issues, specifically women with like urinary frequency, and they utilize like nerve stimulation. So that's something that I've seen that I would feel like would be a little more functional medicine approach versus just putting people on pharmaceuticals. Physical therapy, I feel like, is another example of, a way of utilizing some, functional medicine or, stretching, movement, different ways of moving your body and how that can heal you. I think we're behind the 8 ball in a lot of things, though, when it comes to just sitting in your regular doctor's office.
What do you see as the future of what do you hope the future to look like when it comes to not just your niche of functional medicine in your Rewild clinic, but the overarching view that you hope to see in medical practice in general someday?
Someday, I hope that people can feel heard, like if someone's listening to them. I feel like when you go to your primary doctor, it's a lot of quick turnaround, 20-minute, 30-minute visits, and it's in and out. And I feel like there's not a lot of time to actually sit down and, number one, listen to somebody, but number two is educate people. Most people that I see just don't know. They don't know what things they should or shouldn't eat. They don't know how that affects their body. They don't understand, how their body works. And I think that that's not our fault or the general population's fault. I think that's just a huge gap in medicine, is that we don't spend time and educate people.
And there must be, I'm just assuming that there's some people that go to the doctor with a symptom and want to be heard and deeply understood, and maybe have a practitioner who approaches them from a functional standpoint. But then there also must be others who just want the pill to
Correct.
Just get rid of the
Yes.
symptom.
Correct.
So there's that end of it. Like we're talking about the supply in the medical healthcare systems in the clinics, but then the demand for what type of service people are looking for.
Right.
So, I mean, I suppose your view is probably a little skewed just because people that are coming to you are wanting a natural approach.
Correct.
But what's your hunch on what like the general population is? Is there a shift happening between more people that want to be heard versus people that just want a quick fix pill?
Yeah. I think there's still a lot of people who would prefer to just go in and get a medication and their symptoms are hopefully gone. But I do think that there is a shift. There's change happening. There are people who are starting to feel frustrated, whether they've, gotten a medication and their symptoms are back, or something got worse, secondarily to ignoring, the root of the problem. I think there is a shift happening, but I do feel like there is a good portion of the population who is still, would just prefer to see their general practitioner and do their annual labs and say everything looks great and send them on their way.
So with this vision of yours of the future of medicine, what's the most important part of that puzzle? What's the biggest missing piece? Is it the education of the MDs?
No, I would never say that somebody's not educated that practices medicine. I just think that,
but are they educated on even considering a holistic approach?
No,
So they're
no,
they're not educated to ask the questions that you're asking.
Correct.
So I mean, they're highly educated in what they've been educated in.
Right.
But the way that they learn,
And treat.
yeah. Or like there's just their whole process, their system from start to finish when they see however many patients a day. And I know hospitals are all about turnover. See
Correct.
people send
Yes.
these
It's a
labs.
business.
It's a business, right?
Yeah, it is.
So what needs to change there for that change to happen?
Yeah, I mean, I think it would be great to get to a place where we can teach people how to prevent disease. We can teach people how to live, how to eat, what to do to prevent disease. I think if we could get there, that would be a huge benefit to the population. But unfortunately, at your annual visit, it's just even for people who are healthy, most of the time, I think it's more like, why are you here? You're fine. Why are you here? Or if they have to get some, cancer screening tests or some things ordered, then that's what the visit's about, So I think if we can get to a better preventative medicine standpoint, actually prevent disease, I think that would make a huge shift, huge change.
Is there any of this being taught in any schools?
No, not in medical school.
Like K-12?
No. I mean, no.
Would you be willing to
Yes.
go in and talk?
Yes. But I think it involves revamping the lunch program.
Why? Just because there's a lot of processed food in the lunch program?
Oh, yes. I think, we have all of these children being diagnosed with ADHD, but no one ever goes back and looks at the sugar content of breakfast and lunch at school. We're expecting children to consume 20 plus grams of sugar or more, probably more, in a lunch and sit through the afternoon.
Yeah.
And that's not including, we know the negative effects of things like red dyes. That's not including that, And then if they get a snack in the afternoon, I would bet that that's probably the majority sugar.
Yeah. So even if you take out or decrease the sugar and take out the dyes, you're still left with maybe something that's still processed or not as natural as it ought to be. Mm-hmm. Was it Madison recently did something to drastically change the food in their schools? I don't know if I read that right, if that's Madison.
Yeah.
But it seems like some schools are waking up to it.
Yeah. Yeah.
The superintendent for Reedsburg used to be the superintendent for Viroqua, and Viroqua has been known to be like this progressive hippie type community. Yes. So I'd love to talk to that. Is it Burkhalter?
Yeah,
I think.
Tom, yeah.
That would be neat if Reedsburg could step in and drastically change the contents of our lunch program, breakfast, or whatever food is served.
Yeah. I know one of my children goes to public school, and right now there's like an option of 3. I think they have 3 options for lunch, and all 3 of them are not.
And then there's a la carte, which is usually the worst.
Right.
Yeah. I remember if I had a la carte money, I was like, yes, I can get a Go-Gurt.
Just a bunch of junk.
Yeah.
And it's intriguing to me, giving kids options. Like they know we're supposed to teach them what's good for their body, but we give them options. And one of them is always a peanut butter and jelly sandwich. And of course, my son chooses the peanut butter and jelly sandwich every day. But but children, we're supposed to teach them how to eat. We're supposed to teach them what fuels their body and how to fuel their body correctly, not give them a choice. I think there's some choice in that, but not, you can have a peanut butter and jelly sandwich every single day, 5 days a week.
Yeah. Right.
Mm-hmm.
I think that's what a lot of my kids would choose too.
Yes.
But then there's this fine line between, because you're this holistic natural practitioner, but then we also have to live in the real world, and we don't want to be, I don't know what
ignorant
the right term is, or just, you don't want to be like this health Nazi type, trying to control everything, like realizing that ice cream is good. Right. And like to take that pleasure away from, but moderation is important too.
Correct. So, and I think, we're kind of evolving into this where treats are like something we eat every day and several times a day. Like I love to get a sugary latte, but we probably shouldn't have it every morning. And that's becoming it's evolving into a normal thing to do every day, and the amount of sugar in that. And we normally wouldn't give our kids that much, every single day, but we just allow ourselves treats every day. It's I made it through this stressful day, or I have a really busy day at work. Like I'm going to treat myself to a latte.
Well, sugar's so addictive.
Very, yes, very.
And on multiple levels, right? Physical, where your body can get used to it, or just like if your body is used to processing that much sugar, it's kind of what it's learned to live on. Yeah. So it adapts to that and it evolves into some sort of disease. But then the mental part of it too.
Yes.
Sugar's a tough one. It's like crack.
It is. But most people, when they can cut it out for a good chunk of time, can think clearer. Joint pain goes away. Lots of great things come from cutting sugar out. But you're correct. It's very difficult to get rid of.
Yeah. And find that balance as a mom.
Correct.
Or a teacher or a practitioner of just that fine line, that balance between our culture and what's available,
right,
and what's affordable. Is it is eating optimally more expensive?
Yes.
Why?
Well, I don't know. Whole foods are just more expensive for people. I don't know why it's more expensive, but it is. It's much more expensive for somebody to cook a meal or buy, especially organic. I think, there's the dirty dozen and trying to stay away from pesticides as much as you can. I think of buying a container of berries to give to my kids. Oh. They can they can finish off a container of berries in one sitting.
An $8 container.
Exactly.
Of berries.
When you're buying organic. Yeah. So
even like just berries in general, food in general.
Yeah. I mean, I think that, you know, it can be affordable, you know, but you really have to be, most people don't want to take the time to, you know, grocery shop, meal prep plan, you know, but I think it can be affordable, but it's, you know, a lot of people work, they have kids, their kids are in activities. And so it's a lot of on the go, and those healthier on the go snacks are not cheap, not affordable.
Gardens.
Yes. Right. Yes.
A lot of time.
Yeah.
But also a lot of grounding that takes place in that.
Correct.
And reconnection to our roots.
Nature, right.
And nature.
Yes. Yeah.
Would you say that a lot of your practice is more just kind of ancient rather than like new information, and just sort of rewinding back to practices that you integrate both like new technology with your labs and stuff?
Correct.
with
Yeah. So a lot of it is, yes. And I feel like, you know, sometimes it's things people know, you know, it's not new information. But it's always intriguing to me what it takes for it to click for someone. So, you know, someone can try doing the same thing, or doing, you know, different variations of how they should eat for years and years and years and years. And they can come in and see me, and it can be seeing one lab or one thing that just clicks for them, you know, or doing one thing that clicks for them, and it can change how they live the rest of their life. So I think a lot of it is, you know, very ancient, you know, it's like eating, you know, how we should or how we did, you know, before modern technology and the modern world. But for some people, that is new information. You know, so many people are not used to eating that way. They're not used to preparing meals, cooking, planning, you know, cooking with whole foods. You know, so many of us, I think, were raised on processed, not real food. And so even though it seems so old, it can be so new to people. Yeah. And obviously the labs are just definitely a modern spin on, you know, living kind of, you know, in the ancient times, but you're able to kind of do labs and different tests that sometimes can be helpful for people. You know, like I said, it's what can make something click for someone.
What do you personally avoid in your, either just for yourself or for your household? Like, what are some of the absolute no's? Because some things out of a box in a can are okay, or is that a no?
So
for you?
So same thing for me. It's like, you don't want to be the buzzkill mom who's like, you can't have any sugar, nothing processed. You know, I definitely do not live my life that way with my kids. I try to be very aware of how much sugar they eat in a day, though. Like, I try to be very aware of sugar intake in my kids, and I can see how it affects their bodies physically, even their sleep. So I try to be very aware. Dyes are definitely something that I try to keep as a no in my house. And that's not always the case either. Halloween is a prime example.
You filter the bag?
No. I don't filter the bag, but I did hide their candy.
Awesome. We usually end up throwing it away 2 days later.
Yeah.
It's like, okay, enough.
Yep.
Yeah.
We haven't done this yet. I think next year we'll have to implement where people do the switch, where you basically like give them a toy or something in place of their candy. They leave it out, you know. I'm like, next year, my oldest, I think, is going to be like, where is our candy at next year?
Yeah.
Like, well.
Oh, the candy you give out?
Yeah.
Oh, yeah. Just hoping there's some left over.
Yeah. Oh, no, this is from trick-or-treating.
Oh, the ones that
I hid. Yeah.
Did you trick or treat in the ever so popular Ernstmeyer subdivision?
We did over by the hospital. Yeah.
Okay, yeah.
You can get it done. You can get trick-or-treating done in
it's efficient.
30. It's very efficient. And when you have little kids that can't make it very long anyway, it's like, let's just get this done. They feel, you know, they hit enough houses where they feel done, you know.
My bag's heavy enough.
Yeah, exactly.
And then they get to learn the houses that give out the full size.
Yeah.
Too.
There were some houses giving like 2 handfuls.
Oh, wow.
Okay. That's enough candy.
I feel very lucky to be tucked in where we're not a trick or treat house.
Yeah, same. We're not either.
Trick or treat, but
yeah,
so,
we're not either. It's really nice.
I don't have to buy candy.
Yep.
I just get to receive it.
Yep.
And steal from my kids for a couple days, and then I feel like crap.
Yep. Exactly.
Okay, what else here? For someone who's brand new to this type of integrative care, what is one simple first step you would recommend?
That's a hard one because I really think I base it a lot on someone's symptoms.
Sure.
So that one's a hard one to answer. Can you ask it again?
For someone who's new to integrative care,
Yeah.
and like for the general typical average client, I guess I could say, what is a simple first step or single step? If let's say, let me rephrase this.
Okay.
For someone who's new to integrative care, let's say they don't want to come to your clinic and get all these tests. What is the single best piece of advice you would offer them?
Blood sugar regulation.
Okay.
Regulating your blood sugar.
But with your diet.
With eating.
Okay. Do you ever have people that, and maybe this is just a perception, or maybe you actually hear this, do you have anyone that says, or who believes that holistic care that you do is woo-woo?
Yeah. Oh, yeah.
And what do you say to them?
I've never had anybody say it to my face. Oh. So I don't know what I would say to them.
You're talking like Facebook trolls? Or
yeah. Well, I still work partially in the conventional medicine world, so I know that there's skeptics out there. But I would probably like to share with them some people who I know have changed their lives. And I feel like as medical practitioners, one of the ways to look at that is just in lab work. I mean, I've seen people make significant changes in their lives and cut their inflammation to nothing. You know, I can check an inflammatory marker and their inflammatory marker could have been significantly elevated. And just through food, I've seen people make it back down to normal range.
That's awesome. So we're relatively new at our program as well as you, not as new, but we started in September of the previous year. So we're only in this process 1 year longer than you have, and we've issued 110 wellness grants. And the last question we ask people during our onboard interview is whether they find challenges or success in their journey, would they be willing to share their story on a podcast if it felt right? And I am always surprised. The answer is usually yes. Like I've only had a couple no's out of 100.
Wonderful.
So I invite you to showcase that and brag about that and think of like your top 5 perfect case studies, if you will, to invite them to come in here and you sit in the seat and you interview them and talk about labs and talk about their story and their journey, where they were when they started and where they are now. And then that's something that we would love to showcase to Reedsburg and all of our listeners, what you can do as one of our wellness partners for a client, even if it's unrelated to a Tin Man grant. We would just love to show firsthand. So that invitation is there.
Thank you. I definitely have some people at the top of my brain already.
Okay, cool.
I'd have to ask, but
they're going to say yes.
I hope so.
Let's see. I asked you this. What conditions do you see most frequently? Blood sugar irregulation?
Oh my gosh, yeah. And like I said, insulin resistance, or even like I said, most people walking around have dysglycemia. And that means highs and lows. It's not the stereotypical type 2 diabetic. I mean, most people, if they're eating the standard American diet and not getting enough protein, are walking around with blood sugars all over the place.
And is that getting worse? Are those numbers rising?
I mean, I think, with the food we eat, the chemicals that we eat every day, we don't even know some of it, it's not really food. So I think that's true, but I think that, I don't think it's rising. I think it's been going on for a long time.
Sure. Okay. it might appear to be rising just because our population is rising.
Right.
But I also wonder, because in another podcast, we were talking about the way our agricultural system is set up with the government is we basically, as a government, subsidize the excess production of sugar and corn-fed beef, which are known to be, we already talked about sugar,
Right.
but grass-fed beef is far superior to corn-fed beef.
Correct.
So if our government is subsidizing those excess productions of sugar and corn-fed beef, that makes that lower quality food more affordable.
Right.
And so as food increases, I read an article a couple of weeks ago that McDonald's is seeing some of their key metrics that they haven't seen in quite a while, and it's sort of an indicator of a big change coming to the economy down the near future pipeline, and that there is a decrease in low-income families eating McDonald's and an increase in higher-income families eating McDonald's.
Interesting.
And the article was talking
Well, it's also the cost probably of McDonald's.
Right. So to save money, I mean, believe it or not, to save money, people are going to McDonald's less.
Yeah.
And to save money, wealthier families are eating it more.
Interesting.
So it's sort of like they said it represents a tipping point in their stats that they don't see that very often. The last time they did was in 2007, right before I don't mean to be like a bearer of bad news or anything, but McDonald's thinks there might be something to that.
Well, and going back to corn-fed beef, it's essentially when we're consuming animals, how the animal is treated matters too. I mean, you see, if someone's eating corn all the time, what corn does to our blood sugar is it causes a blood sugar spike, and then always there's a drop in our blood sugar. And so if we're consuming an animal who has probably dysregulated blood sugars, how that must affect our body too, right? It's just like, when we eat high carb diets and processed, foods, what that does to our body, and what type of fat we store. That's white fat, which is kind of the bad fat. Or I shouldn't say bad fat, but it's the not healthy fat.
Sure.
And so if you have an animal that's consuming that, well, what is that animal bringing to you then when you're consuming it?
Mm-hmm. Yeah. Mm-hmm. There's a lot of questions you can ask to rewind. Just thinking of food doesn't really come from the grocery store, but a lot of us think that.
Yeah. It's where we hunt and gather.
Yeah. Right. Yeah.
Right.
It is.
Yeah.
Okay, circling back to this question I asked you before, of anything that you avoid. Are you pretty liberal with that, or are you absolutely no? Are you like grass-fed beef only? Are you organic only, or do you sort of just balance?
I try to balance it. I definitely for the Dirty Dozen, I try.
Okay, what is that? You said.
Oh, so the Dirty Dozen would be berries, peppers, grapes, bell peppers, green peppers, grapes, basically any food that's sweet. That's what the bugs tend to eat or consume when it's being grown. And so that's the most common fruits that they spray pesticides on.
Oh, okay.
So that they yield a good crop, essentially.
Sure. Strawberries.
Correct. Strawberries, raspberries, blueberries, grapes, bell peppers. Yeah. So any sweeter fruit or vegetable, tomatoes even can be sprayed a lot of times.
So just wash the heck out of your produce?
Yeah. But still, it's in the soil, so it's probably still, affected. And really our soil is not great anyway. So, but yeah, so the Dirty Dozen are just the ones that you would want to stick to, like in terms of organic. So I don't, if you're going to consume something with a peel, like I think that's probably a little bit safer to go outside of the box if you were trying to like decide what you should purchase that's organic and what you should purchase that's not organic.
Sure. We signed up with Orange Cat Community Farm a few years ago.
Yeah.
And this last year we dropped down to a half a share because we had so much. We felt bad last year. We couldn't even eat it all.
Yeah.
So that's an abundant source of amazing organic food grown with love, cared for, and beautiful soil that you can go look at.
Yes. Yeah.
And they don't sponsor the podcast, but I will give
but if you want to
for Orange Cat Community Farm.
Yes.
And Idaho Valley Farm.
I don't know if I've heard of Idaho Valley Farm.
The Idy family, halfway between here and Lime Ridge.
Sure.
They grow, they raise organic, grass-fed Scottish Highlands.
Awesome.
And some Scottish Highlands / Jersey mix. So if we really take the time to look, there are local options that exist.
Yes.
I mean,
and honestly, not, I think some people think like, well, that's not affordable. And that's not true. I mean, sometimes it's actually less expensive.
Well, especially if you look at the portion too.
Yes.
Like you don't have to eat a half-pound hamburger, right? Like what about the quarter? You can make quarter pounders at home.
Right.
Even that, I made a quarter pounders the other day, and usually I make third pounders. And that's a lot. It's a big burger.
Yeah.
And so we had to feed so many people. We only had so much meat. So I'm making quarter pounders. And I remember thinking to myself, that was plenty of meat.
Yeah.
You could even have gone less than that if you really want to smash the patty.
Right.
So we can think about that too. Maybe eat a few more veggies. Cause that Orange Cat Community Farm, I forgot exactly what it costs, but I did the math once a couple years ago on the cost per meal, just like based on calories in a box throughout the year. And it is, if you're a member of Orange Cat, it's a very affordable way to eat organic veggies.
Yeah.
The problem is we crave so much meat that if we just switch the proportions and had a bigger pile of veggies and a smaller pile of meat.
No, meat's great. I'm all for, people getting enough protein. I think one of the things that I'll explain to people, especially people who have dysglycemia or are insulin resistant, is, protein is what actually balances our blood sugar. And so, say we consume a meal and we get a little rise in our blood sugar, as long as you're getting enough protein, that should sustain and you shouldn't have like a spike and a drop. So animal protein is great. It's simple carbohydrates that are the villain.
Okay. What about sourdough bread?
Yes.
Guess
the
what?
villain.
That's a villain?
No, I mean, so in moderation, right? Or if you're getting enough protein with a simple carbohydrate, that makes a big difference too. But just, simple carbs are usually what will cause our blood sugar to be dysregulated.
Okay. But I guess I'm talking about sourdough specifically versus store-bought white bread.
Oh, I think, in terms of chemicals and sugar, I think that's probably better, homemade sourdough bread. But usually it still will cause a blood sugar spike.
Okay.
And like I said, a blood sugar spike is always followed by a drop.
Okay. Interesting. Because I've heard the opposite about sourdough. I've heard that it doesn't cause a spike.
It probably depends the person too. Like bananas are a great example, so what I explain to people a lot of times is, when we eat a fruit, for example, the fiber content matters because fiber is what helps our body break it down slower. So we don't get that high spike in our blood sugar very quickly. But if you juice a fruit, that's a very different response because you're removing that fiber from it. And so banana would be another example, but also our gut microbiome can actually vary from person to person. And so somebody's gut microbiome may respond a little bit differently to something like a banana, and they may actually have a blood sugar spike with a banana, even if they add a little bit of protein with that banana versus another person. So it just depends.
Okay.
Every person and their gut microbiome is different too, and how they respond to foods.
Sure. I like to believe that sourdough is healthy because I am Well, I'm a sourdough geek.
Are you?
And it's like my passion to make sourdough and
Yeah.
eat sourdough. Tonight we're having sourdough grilled cheese.
Oh, yum.
So I'm going to pretend I didn't hear that.
Okay.
But no, thank you
For blood sugar
sharing.
regulation, usually what I'll tell people is if you can eat it, or if you can kill it, or if you can grow it. Those are great things for your blood sugar.
Yeah. What inspired you to become a partner with the Blake Matthew Mindful Memorial Foundation?
I think it's a great thing for the community, especially to be aware of mental health and how it can affect us. And like I said, I see people with chronic stress every day. And just to be able to improve access to health for everybody, I think is a great resource to the community.
Thank you.
Yeah.
What do you believe is possible for individuals and our community when we reconnect with nature and the original nature of ourselves?
Longevity, healing.
What legacy do you hope Rewild Natural Health leaves?
I hope that it helps, or I hope that people feel empowered to take charge of their life. And for somebody to know that just because your mom was a diabetic or had, breast cancer, that doesn't mean that's going to be your, what you're going to experience.
Sure. We can change the course of our
Health.
folklore before us and
Correct.
the generations to come after.
Yes. Yes.
If you could put one sentence on a billboard, what would it be?
Oh, I don't even know.
Call me.
Did you eat protein before coffee this morning?
So that's a big one.
It's a huge one.
Okay.
Yeah. Because, like I said, I see most people with cortisol issues, and that's most people will wake up in the morning and have their cup of coffee without anything to eat.
Okay. So
Which is
protein, but not necessarily just food in general, protein.
correct. Yeah. For blood sugar regulation, a lot of times coffee on an empty stomach with some cream, will increase someone's blood sugar.
So what would you recommend for someone who is a vegan before their coffee? Quinoa?
I think legumes are a good source of protein for people who are vegan. Tofu, those aren't certainly breakfast foods, but and that's the biggest drawback, honestly, to vegetarian or vegan or plant-based diets is that they are not getting enough protein.
Mm-hmm.
Not even close.
I know there's only a few plants that have a complete protein.
Right.
I think quinoa is one of them.
Yep.
And is it hemp seed another one?
I don't know.
And then I forgot the
don't
third. I don't know that for a fact. I just thought that. I read that once.
Yeah. It's hard. That would be very challenging to eat a plant-based diet and get enough protein and have blood sugar regulation.
My last question.
Okay.
What is your favorite personal practice to stay grounded and healthy?
Oh, walking outside.
Is that a daily thing for you?
I will admit, with small kids, it's the hardest thing for me to do, especially, with the time change and it getting dark. But when I feel my best is when I'm doing it every day, getting outside, walking, being outside.
Awesome. Even in the winter?
Yes.
Maybe especially.
Yes. And I think, in Wisconsin, that's when most people feel disconnected because most people don't want to be outside in the winter.
Yeah. Well, I'm looking forward to officially launching you as a wellness partner, which there's like a backlog of 5 or 10
That's okay.
wellness partners that have signed up that we haven't.
That's great.
We need to change the portion of our website where we showcase all of our wellness partners, because right now it's like a scroll thing. So you're really lucky if you're first and you're really unlucky if you're last.
Right.
So I got to figure that out.
Yeah.
Some sort of filter, maybe search thing, but excited for 2026 because there is a lot of great things that are going to happen.
Right.
Now that, well, maybe I'll hold off on that. But I am looking forward to issuing Tin Man coins to people that really want to dive deeper into their integrative approach to some symptoms that they have. And by saying, go see Morgan.
Yes.
I think one of the greatest things about the services you offer is it is affordable.
Yeah.
Walk me through. Give me a range of what the typical person, and I'm sure this is all over the board, but like what would be a minimum and maximum program with you as far as cost out of pocket?
Oh gosh. I mean, it can be as little as, $200 or $300. Could be the number on the other end. It could be, it's just, it's as much testing as somebody wants to do, really. And that's what I'll tell people when I see them. It's like functional medicine. You can run all of the tests through the roof. But I think one thing that we always have to ask ourselves is, well, what will we do with the results of the tests, And so a lot of times I'll work with people, give them options on like, we can assume it's this, we can treat it like this. And if the symptoms don't go away, then we can, say like, well, we should probably revisit testing. So I really try to work with people, make it as affordable or, make as much sense with them as I can.
Okay.
So, but the higher end, I mean, it just depends the person. I mean, you could spend thousands of dollars on functional medicine tests.
Yeah.
There's nutrition tests that look at every vitamin and mineral and your omegas and everything. And it's like a $600 test, Okay. So there's lots of tests that you can do.
Yeah.
And some of them are covered by insurance. Most of them aren't. I think some things, even Medicare will pay for. And I'm actually, one of my goals is to be able to take insurance for new patient consults and follow-up visits too. That's like one of my goals for 2026. So
awesome. Very cool.
Yeah. So make my care a little more accessible to even people who might not be able to afford it.
Yeah. And that's our goal. We see that as our place too in our community, because most of our fundraising happens locally. So we look at it as the community members of the Reedsburg area and beyond, but mostly Reedsburg, are contributing to this foundation through attending the Tin Man or making donations. And really that is an investment in some sort of like kind of like an insurance for the community where those who cannot afford to attend certain services that are probably not covered by insurance for their mental health or their physical health. And as we've touched on, 9 times out of 10, those two are integrated, like a chicken egg thing. Right?
Always.
What came first? I recently was certified as a language of breath worker, and it was this language of breath philosophy was created by a guy named Jesse Coomer, who was a language professor at a college, and he found himself drinking, got into some drugs, whatever, just like kind of a low point in his life, and then found breath work with these different teachers. He studied this guy named Dan Brule, he studied Wim Hof, and studied the ancient breath workers and new age breath workers, and took everything he learned and put it into his program that he calls the language of breath. And when he created that, he was involved in part of the study where these people were studied with how they breathe through nose breathing monitors. And the people that were studied during the period, like they also measured their stress levels, their cortisol levels, their daily routines and their habits. And what they found, the results of the study showed, was that their breathing was different when their stress levels were spiking.
Yes. They have shallow breathing.
So it begged the question, were they in that stressed state because of how they were breathing, or were they breathing that way because of the stressed state? And the answer was, it's a very simple both.
Yeah.
We can use our breath to help regulate.
Correct.
And up-regulate or down-regulate our nervous system, depending on what we want. Maybe we want energy. Maybe we want focus. Maybe we want calm. Maybe we want peace.
Yeah.
And so.
And that's all affects our vagus nerve.
Yes. And
our vagal tone.
And our ability, our body's ability to handle stress is. During that study, they also found that there was a direct correlation with our body's ability to tolerate CO2 and our body's ability to handle stress. So through certain breathing practices of specifically CO2 tolerance training, we can work on those exercises to increase our body's ability to tolerate CO2. And a side effect bonus of that is that our bodies are more tolerant of handling stress.
Interesting. Stress resilience.
Yes.
Yeah.
So instead of going to see a therapist to deal with all the little micro stressors in our lives that are constantly evolving and changing, and instead of looking at each little problem and addressing those, it's like, okay, another way to approach it is to, of course, dive into all of the holistic and integrative ways we can get back and rewild ourselves
Right.
and reconnect with this breath that we've had ever since we came out of our mothers,
Right.
that we will have till
Right.
we take our last exhale, and reunite it like an old friend, and come together with it to create a better relationship with ourselves and with our nervous system.
Right.
So I hope to have these cross referrals between us where we can send people to you, and then maybe a follow-up part of their journey can be to, maybe if they're open to it,
Yeah.
getting some breath coaching.
Right. Yes. Definitely.
Because between breath work and sourdough, those are my two favorite things to talk about. So thank you very much. You are such a beautifully aligned partner for our foundation, and I look forward to working more with you.
Awesome. Thank
Morgan,
you.
thank you.
Thank you.